Beet juice. It's been suggested to some of my athletes who are female. What is your take on beet juice?
So beet juice or nitrates, it's really interesting when we start looking at the research. As a physiologist, I understand endothelial factors. So what is that, right? So we think about endothelial cells, and these are the lining of our blood vessels, the cells that line our blood vessels that are responsible for things like vasoconstriction, vasocontraction, sorry, contraction, dilation. And we see that estrogen is tightly tied to that nitric oxide cycle. If we are introducing nitrates as a woman who is in her reproductive years, you're interfering with the normal responses of estrogen in the nitric oxide cycle. So we look at some of Kate Wickham's research, and she is looking specifically at premenopausal reproductive women versus peri and postmenopausal, and found that women who were in their reproductive years using beet juice or nitrates for performance enhancement actually had a decrease in their performance, a decrease in their VO2 max because of this interference. But for postmenopausal women who had that flatlining of estradiol, they did see a boost in performance because now the nitrates were able to work the way they should.
Yeah.
So there is a definitive sex difference when we're looking at using beet juice for performance enhancement. For men with the lack of estradiol effect on their blood vessels, yes, it works. For women in reproductive years, it impedes performance. But for women who are postmenopausal, it works like it does in men. It actually helps with the vasodilation constriction factors.